So, good morning everybody. Yes, as per introduction, my name's Michelle Morris. I'm one of the teaching fellows for MDD here at NUH. I'm not sure if I'm following John now or following my son, listening, saying silly words. But my project was about knowledge sharing between CP3 students and sharing their knowledge from bedside teaching. So I'd like to begin by asking you to reflect for a moment on some of the words from John Alcalado. Oh, sorry. Look at your screen, Michelle. Okay. So some of the words from John Alcalado. So bedside teaching has the potential to be one of the most effective modalities in medical education. Okay, so give me a minute. It can provide all the elements associated with effective deep learning. So it's interactive, it's relevant, it gives meaning to all the signs and symptoms that we teach our students about. They see the real patient with those real signs and symptoms, but also real social issues and patients' real perceptions, unlike, sorry to say it, some of the sanitised things that we do in simulation. Okay, so this is the patient's real experience. In MDD teaching at QMC, we have an attachment of 25 to 30 students. We divide them into 5 groups, and each group will have a lower limb, an upper limb, spinal teaching, and a rheumatology bedside teaching. Okay. Each session normally includes some history taking, some examination skills, X-ray interpretation, and we'll talk about any pathology-specific kind of teaching or learning points that come up with any of the patients that we see. Now, the limitations are, as we all probably know, anyone that does bedside teaching, is it's hugely opportunistic. So we take a lot of time to go around and meet patients, try and work out, find patients that have got really good signs that would be interesting for the patients to see. But the problem is, particularly in this trust, because it's such an acute trust, and a lot of the bedside teachers is on trauma wards, is that you have a patient with fantastic signs and something really interesting, and then because the teaching is repeated 5 times, the next group won't see that patient. So my concern was, how do I share the knowledge that one group will see? So, for example, this week there seems to be an abundance of patients with really interesting ankle fractures with external fixation devices. By the time the 5th group comes, they might have all gone home. So how do we share that experience and avoid that variability that we so often experience? So how do we improve some consistency? So a little bit of thinking, probably a bit of a Sunday night idea. I was mulling this over and thought, I know, what I'll do is ask the students, each group, to think of one of the cases that they've seen and write a question around that case, okay, and then those students can share those at the end of the attachment. Okay, so what I wanted to find out was, do students perceive the use of student-authored questions administered as a quiz as a useful method of gaining and sharing knowledge with their peers, and also would they find that useful in their revision? Okay, I'd like you to bear in mind that this was conducted at the end of the CP3 rotation, so most of them were entirely focused on their final exam in February. Okay, so what I did is for the final 2 MDD attachments, which involved 52 students, as I said, at the end of their first bedside teaching session, I asked each group to write one 3 to 5 part question on a case that they'd seen. They could choose their own format, so they could base some simple questions on the pathology itself, they could formulate a vignette style question, or they could write an MCQ type style question. It didn't really matter which format they chose, but I asked them to write a question. I asked them to submit the questions that they'd written with the answers to me 2 weeks before their first revision session, which then I compiled into an online app-based quiz. And then at the final revision session, I got each group to perform the quiz. So what that meant is that each group then performed the 4 other groups and their own group's questions. Okay, so they made a little quiz. So everyone shared their quiz answers. And I also got feedback using Mentimeter, mostly using a 5-point Likert scale, but also some free text qualitative responses. Okay, so what did I find? Well, my initial concern, and a little bit anecdotally, what I sort of wondered is how much do people already share their knowledge. So how much they say, I saw this really good patient who had this fracture, and how they managed it was, and the risks for that fracture were. So how much did they do that? So as I suspected, most people shared with their friends, and they might share within their group or their firm, but really only 27% of those students shared with the whole of attachment. So there wasn't really that much sharing, which was my concern in the first place. Okay, so I asked them about writing questions, and 94% of the students said that by writing all the questions, they gained new knowledge. Also, 63% said that it helped them revise, and only 6% said that it didn't further their learning. So they all found it actually did, by actually writing the question, did further their learning themselves. Okay. One of the things I was concerned about, and something probably to look into, was would I end up with a scenario that one diligent or enthusiastic or motivated student would end up writing the question for the rest of their group, and the other sort of 4 or 5 would sit there and say thank you very much. I think there was an even spread across the group, and this is probably something you can investigate a bit further, but would reflect on their own motivation and self-regulation. Okay. When answering the questions, although a lot of people said that they felt that they knew the answer to the other group's questions, again, most of the students said that they gained some new knowledge by answering the questions. It helps share. It was a reliable way or a helpful way of sharing knowledge between groups so they could experience what the other students had seen, and actually they found it enjoyable. Okay, some of the qualitative responses that came across, I'll give you a moment just to have a read of those. Okay, so 52 students and 32 chose to leave some qualitative responses. Overwhelmingly, the students said that they found it a useful exercise. It was useful to share the common pathologies. They found it helpful to kind of look at prior knowledge from the other students. It was fun, it was interactive. Someone said they hadn't done it before, and it was quite a nice way to share the knowledge. The other thing that they quite liked is benchmarking themselves, and in MDD they do a mid-course demonstration where they have a sort of benchmark or sort of internal benchmarking exercise where they judge themselves against their peers, and I think they valued, particularly as I say, as exams were looming in the forefront of their mind, they valued that opportunity to kind of measure themselves with their peers and how well they were doing and identify any gaps in their knowledge, so they really valued that. Okay. There were a couple of things that, I don't know if this was surprising, but if there were 3 comments that said that they would have preferred the questions to be in an MCQ type format. Now it is kind of worth remembering that I did offer them that opportunity, but it sometimes can be a little bit trickier to write those questions, and they're studying quite hard at this point, so it's quite time consuming to write some MDD questions. And one of them said it would have been nice if I wrote the questions, but that does defeat the object a little bit, because the purpose is that they reflect on what they've seen and what they learn and share it with their peers, so I didn't. I did put it in a quiz, and I did threaten something if they sent it to me at 11 o'clock the night before the teaching session. I think the threat worked because they were quite good. Another comment that was quite interesting is a couple of people said that rather than complete the quiz as a group, that they would have liked to have had a go at that on their own and spent a little bit longer. So that might reflect different learning styles. And I'll come to a little bit more about that in the discussion and some of the thoughts that I had. But overall, the students found this a really enjoyable thing to do, because I was concerned that they'd roll their eyes out loud that I'd given them another piece of work to do. But no, they all engaged with it without too much difficulty, and as the results say, they enjoyed it. It did provide that useful kind of vehicle for space practice that's so effective for learning. So they saw the patient in the beginning, halfway through the attachment they reflected on what they saw, and then they reflected and answered some questions on it on the end, and we know that that's an effective practice for learning. It encouraged teamwork and collaboration, which the GMC quite rightly, and all hospitals want us to encourage. They work together because, as I said before, and as it looks like on the initial slide about whether they work together or whether they share their knowledge, it appears that mostly they don't. Okay. And there's some really nice evidence around about peer-assisted learning, that it can be really effective, and they did really seem to value the information, the learning and the research that their peers had done. Okay. However, one of the drawbacks is whether they felt they gained new knowledge. It was self-reported, so I didn't measure whether they actually gained new knowledge, but they felt that they did, and for confidence approaching the exams, that can only be a valuable thing. It does require a little bit of facilitation of group dynamics, because, as I say, they have to work together and coordinate. So if you have some problems with group dynamics, that could be a problem. But I didn't have any of those, but you do need to make sure they're quite a cohesive group. And as I say, my discussion that independent answering may benefit some students because it just gives them time to think about the questions and sort of revise in a deeper way, because hopefully it triggers more questions, and if they're at home they can go and sort of investigate that a little bit further. And one of the concerns is that you may have some quieter members in your group, and it's hard to ascertain, are they quiet because they're thinking, or are they quiet because they don't know? And you do run the risk of more dominant group members answering all the questions. And the other effect, I don't know if some of you have noticed, that even if the answer's not correct, some of the dominant group members can persuade people quite well that it is. And I've seen quite a lot of that, and a little bit of head in hands. So by answering as a group rather than independently, what it did allow me to do was listen to the discussions, so listen to the peer learning that was happening, and interject if something was wildly off the mark. So moving forwards, I'm going to, and I've started again, so I'm going to continue using student-authored questions, but compare responses, whether they complete the quiz on their own independently or whether they do it as a group, and see if there's any differences in the benefits. Okay, and that was my project. Thank you very much.